Health officials say earlier guidelines were based on a model for care in remote places and with workers who don't have much training.
Those new guidelines call into question tonight just how prepared was the United States to handle the Ebola virus. WIAT 42 News reporter Jamie Ostroff spoke with one of the nation's leading biosafety experts right here in Birmingham to find out. Jamie.
This woman is consulting with hospitals all over the country in helping them prepare for Ebola. Now, while she says these newer CDC guidelines are a step in the right direction, America is not 100% prepared yet. But armed with the right information, she says we can be. Since Deborah Sharp came back to the United States from Nigeria in August, she's been pretty busy.
I've been getting a lot of calls from hospitals and from public health departments.
After spending weeks training hundreds of African healthcare workers to care for Ebola patients, American hospitals want her advice too.
I think that should have happened before now, and I think CDC probably should have led the way on that a little bit, but you know, that's really not what they do routinely. That's not their area of expertise.
Sharp says an Ebola infection in Birmingham is a real possibility. While local hospitals and first responders try to ready their staff,
well, they're doing the best with what they know.
Sharp says there's a lot they don't know about dealing with a virus they've never seen firsthand.
So there are ways, but you need training to understand how to do this and to put it in bags, double bag it, put it in secondary containers, spray down all of those containers, and then transport it to where it would be incinerated.
That type of training takes weeks, Sharp says. So during that time, Sharp is calling for a better understanding among the American people, starting with the CDC.
I think initially saying any hospital could treat an Ebola virus patient was really the wrong thing to say, because those of us in the biosafety community just, you know, shook our heads when we heard that.
And ending with less fear.
It's easy to kill. I mean, that's the thing people don't understand.
Sharp also told me when she first arrived in Nigeria, the vast majority of healthcare workers weren't even wearing latex gloves to help treat Ebola patients. And in contrast, as of today, the World Health Organization declared that country Ebola-free. We are live in Birmingham tonight. Jamie Ostroff, WIAT 42 News, coverage you can count on.